All right. Welcome, everybody, to the Fit for the Fairway, Bogey-Free, and Back Pain-Free workshop tonight. So there's a lot of stuff that we're going to cover, and hopefully I can make this as helpful and informative as I can for you. Let's get started and make sure you're in the right place. So this workshop is for you. If you're frustrated that your game isn't improving, despite you just bought new equipment, like that new driver, I love it, shiny, promises 20 more yards. Well, it didn't work out. I don't know. It's also for you if your back nine is not as good as your front nine. I have a lot of clients that come in and say they would love to play 36 holes in a day, but they're sore, they're pain, they have pain, or they're tired and they can't make it. And that's even in one round, they're feeling the same thing, is that their performance is not as good as it is on the front nine. So this workshop is also for you if you want to play longer golf. It's all about playing longer in yards and years. So, as we age, we don't want to lose distance. And there's ways to tap into your body's speed centers so that we can train that speed and get more club head speed and more distance. So it makes the game a little bit more enjoyable. So we're not losing distance as we age. All right. And more importantly, this workshop is for you if you have pain when you swing a golf club, right? So the golf swing is a very dynamic and high-speed motion, right? So it's a lot of speed, a lot of power. And you know what? If you're experiencing pain with it, it's going to be tough to perform your best. So you want to make sure that you have no pain, you're pain-free when you're playing golf. And you know what? This workshop is for you too. If you don't even have pain, but you want to learn more about the body swing connection, we're going to be talking a lot about how your body relates to your swing and it dictates what your swing looks like. All right, so things you'll learn today or tonight. You're going to learn the root cause of back pain in golf, the 3 key exercises to unlock your golf mobility, and how the professional golfers swing with effortless power and speed. What is their secret? Well, we're going to talk about that tonight. What's in it for you? Well, you're going to stay pain-free, all right? You're going to be able to live life to its fullest, enjoy your round without having much of an issue, and you're going to increase your distance. Who doesn't want to add 10 to 20 yards? But you know what? I will say this. If, I always ask that question for my clients. It's like, do you want to hit the ball farther? But a lot of my clients are having problems because they're having issues with their club distances, with their approach to the green, because they're hitting the ball a club length or 2 club lengths farther than what they think, because they're moving so much better. So they have to adjust and take some time to find those distances again. So you're going to know what the pros know of how to use the ground, how to play well, how to play pain-free. And then you're going to make this year your best one yet. All right. With all the information that we're going to be talking about tonight. Now, just as a little information here about what is this material that we're going to be going over tonight. Majority of major championship winners were advised by a TPI expert. All right. The top players in the world have a TPI expert on their staff. And majority of the top golf fitness professionals are certified by the TPI system. So the TPI is basically the Titleist Performance Institute. And their philosophy is the body swing connection. If we can improve how you move, we can improve how you swing. Because no matter how much instruction you get or how expensive your equipment is, your body can only do what it is capable of doing. So if a player is limited by what their body can do, they have 2 options, all right? You can either build a swing that works around your limitations and just play the way that you are, or work towards your goals, improving your body, work with a fitness or medical professional to change those limitations so that you can play pain-free and play the best golf you've ever played. All right. So who is this person? Who is this guy talking? If you haven't been to my courses, my name is Dr. Paul Cachola. Let me pull up my slides here. So that's me. I'm Dr. Paul Cachola. I am a physical therapist, owner of PAR5 Physical Therapy here in Randolph, New Jersey. And I'm an orthopedic clinical specialist. I've been certified a level 3 golf medical professional from the CPI or Titleist Performance Institute. I'm a certified dry needling specialist. And for the past, I don't know, 15, I want to say 15 years, I've been helping golfers of all ages move better, feel better, and play better. All right. So a little disclaimer, because I'm a physical therapist, I have to give you this. Like, if you're dealing with some specific pain, the information that we're going to be going over in this workshop is going to be targeted at a broad population. All right. So you want to be aware that if you're going to need a customized physical assessment and treatment plan to successfully treat all of the associated factors and root causes of your pain, okay, and your specific dysfunction. So a lot of the stuff that we're going to be talking about is really valuable. I usually tell a lot of my golfers a lot of the key things that we're going to be, because I'm so excited to share this with you. And it's definitely changed their game. It's opened up their eyes on how to swing a golf club. All right. Another important note, that the success or your ability to achieve your goals is dedicated, or it's hinging on consistency. You have to be consistent with these exercises. If you've been swinging or have some type of mobility dysfunction that's been going on for years and you don't know why, and we find out what the root cause is, don't expect that movement dysfunction to go away within a week. All right. It's going to take 3, maybe 6 weeks to make a difference in how you move and how you feel. This one client I saw, had the most dramatic change that we test club head speed at the beginning of the program. So he comes in, we assess it, and then 6 weeks later, he's increased his club head speed 10 miles per hour. And he came in with back pain, right? And this is probably one of the most dramatic changes. So, it is possible, even despite your age, to make changes in your body. All right. So I'm so happy that you guys are here. I want to make sure that I could see the chat window. If we do have some issues or questions, use the chat. And I've got a special offer for everybody that's here tonight, and news on some exciting things. All right. So let's get started a little bit into it, right? So golfers can benefit from a healthy and efficient body. What does that mean? So this is not just for golf, but it's for life and function, right? You want to be able to age well, be functional, be strong, be healthy, look good, feel good, and play well, right? Golf is a sport. And, athletes in other sports, they get hurt. And we never say, oh, that athlete should never be in the gym. They work out too much. But we say that about golfers. Now, the trend is changing a little bit. Happily, that it is changing, that the stigma around lifting weights, moving fast in the gym is lessening because of all the information that's out there. There's a lot of specials online, TV shows, series that dive into what athletes have to do to perform their best week in and week out. All right. It's the ability to change and recover, change their dysfunctions, get better, and move better. So this is, if we're going to cover a lot of stuff tonight, but if you remember one thing, remember this, that the body functions on an alternating pattern of stability and mobility. All right. If this pattern is disrupted, then pain or injury is the result. Okay. I'm going to say it again because it's so important. The body functions on an alternating pattern of stability and mobility. If this pattern is disrupted, pain or injury is usually the result. So that means that your lower back, for example, we're going to be talking about the lower back a lot. It's designed to be a stable segment. All right. The segments above and below are your T-spine, your thoracic spine, and your pelvis or your hips. Those things need to be mobile. Those 2 points above and below, those blue dots. The red dot, lower back stable. If you have back pain, it's often, in my 25 years of physical therapy practice, low back pain is usually caused by something else, not in the back. The back hurts because of either some pelvic or hip issue that you can't mobilize or move the hip, your hip gets tight, or your thoracic spine gets tight. And if those 2 things become a stable segment because they lose their mobility, your lower back becomes unstable. Your body finds a way to compensate around your issues and says, hey, you know what? I got a tight hip. How do I make up or get that range of motion back? I'm just going to unlock the lower back. So if we're swinging a club and moving and playing sports, if you're tight in the hips or tight in your thoracic spine, your lower back is going to take the brunt of it. And that's what causes the majority of the back pain symptoms that I see. All right. So the key to the club head speed, to increasing the club head speed, is the kinematic sequence. All right. To train for golf, we have to understand the movement that is required of the body. What does the body need to do? So we're going to show some graphs here. This is the rotational kinematic sequence in degrees per second. Let me pull this up so you can get a better look at this. So the rotational kinematic sequence of degrees per second. So we have the red line, which is the pelvis, the green line, which is the thorax, the blue line, which is the arm, and then the gold line is the club. Okay, so here we go. If I take a closer look at it, let's zoom in. The red is the lower body. The green is the torso, and then the blue arms, the blue is the arms, and then the gold is the club. And from the top of the golf swing, we want to see top of the, what do you call it? Top of the backswing, sorry, through it to impact. That's the gray area. All right, we want to see what those things are. So we're going to zoom into that. Each segment builds on the previous segment, increase in speed up the chain. So each segment then slows down once the next segment begins to accelerate. It transfers its kinematic, its rotational speed and force to the next segment. For example, let's see if I can pull this and go, here's my cursor here, awesome. This is the pelvis, it's rotating, and the peak force is right here. That's the peak speed. But then after that, it slows down because it transfers that speed and rotation to the thorax, which peaks there. And a split second later, the arm reaches its peak speed, and then later the club reaches its peak speed. So the big thing with this is that if we measure this, this is the most like a whip. We magnify and increase the speed segment by segment. If this graph looks awkward, you know, it looks wonky, then oftentimes we'll have leaks of speed. All right. The key to acceleration is deceleration. We talked about this, the downstream acceleration from red, you know, to the green, and then peaking to the blue, and then to the gold. Okay. So the analogy that I like to use is swimmers. If you were swimming in the pool and you're swimming right next to somebody else and you wanted to pass them, the easiest way to try and pass them is grab their body, grab their trunks, grab their arm, grab their leg, and pull yourself past them. And that's what your body needs to do with this kinematic sequence. All right. So the next thing that we're going to talk about is ground reaction force. How do you use the ground to generate this speed? And a lot of times people come in to say, you know, this is when I talk to golfers that come to see me, you know, they always say, you know, I got to get my club this way. My golf swing coach is saying I got to bring it to the inside, swing it here like this, and very concerned about what's going on up top here with the arms, with the trunk, and the hands. But they forget that this sequence, the kinematic sequence, happens from the ground up. Ground reaction force for all golfers, it's not about just shifting the weight from your trail side to your lead side. It's about creating force. Ground reaction force, not a weight shift, it's different. And I'll show you that in a second. Is that, yes, certainly, we want that weight shift to go laterally from, if you're a right-handed golfer, from your right foot to your left foot to your lead side. But because it's a rotary movement, the golf swing requires a push and pull, okay? And here's, let me pull this up so you could see this. This is a hockey player. He's on the ice, and he's got a golf club, and he's got a golf ball there, and he's gonna hit it. And I want you to pay attention to what happens with his feet, all right? So I'm gonna advance this, we'll take a look. So pretty quiet takeaway, to top of your backswing, and then he goes down, and he hits the ball, and it goes into the net, goes straight, okay? But I want you to pay attention, because he's on ice, when he creates that force through the feet, they slip, they move, the feet move, all right? And you can see how the right leg, his trail leg, goes backwards, and his lead leg goes forward, okay? And this is the move that changes a lot of my clients' golf swings for the better, is that the lead foot needs that force, not just to shift your weight to the left, but pushing or kicking that left foot forward, that lead foot forward, okay? We see this all the time with a lot of specifically the long drive hitters, because the forces they use are huge. So if I pull up, you know, this video here of the foot action of long drive hitters, they squat, they get down, they really use their legs, and they're pushing back with that lead leg so much that it moves backwards. They're jumping, right? That move, that pushing back, also helps to counteract the centripetal force of that club as it goes forward. Other clients that I've seen, when they swing really hard and fast at follow through, they tend to fall forward. They lose their balance forward, because as you generate that speed, the mass of that club needs to be counteracted by your pull, which is basically you pushing away from the ground, pushing backwards with your leg, with your lead leg, to create a force that counteracts that weight of the club going forward. All right, so these are 3 common swing characteristics that might turn into faults if they get really bad. So you've probably seen some of these before. You know, the golf swing is all about rotation. The pelvis, it needs to rotate, you know, and the pelvis is an ellipse. Okay, it's like an oval. Okay, we have this line here that Dave Phillips, one of the instructors at TPI, has drawn at his hips. He wants to, at the top of the backswing, be able to have his back hip touch that line, and then at impact, his lead hip touches that line, right? We want to maintain that, but a fault that some people have is early extension during the top of their backswing, or during their backswing, or their downswing. Their pelvis comes away from that line. It basically, they lose their posture, which creates this inconsistent impact position. It can cause shoulder, elbow, wrist pain as well as loss of distance and you know, faulty swing paths. Okay, and it's directly related to your distance, your golf speed distance. So these are 3 professional golfers here. We have Jimmy Walker on the left, all the way on the left. We have Dustin Johnson in the middle, and Justin James. Justin James is a long drive hitter. We drew the line. You could see here at their pelvis, at address, and when they swing, you could see the relationship of the hip. Jimmy Walker's pelvis comes off of that line, and he is the shortest of all of these 3 hitters. The longest hitter is Justin James. You can see his hips remain in contact and actually pass the line as he gets into impact. And you can know Dustin Johnson, his hip touches and goes past that line a little bit, but at least it maintains contact through the downswing. All right. Another one, and then this is very much 100% related to lower back pain in golfers. Okay. If you have lower back pain, you probably have a reverse spine angle. Okay. This is basically an overextension of the upper body, not rotation. Okay. The core, the abdominal shut off, and it results into low back pain. All right. So at the top of your backswing, your torso, especially with these drivers, you're trying to hit up on that ball. Your torso needs to be, the spine angle needs to be pointed away from your target line. If it points towards the target line, which often happens with limited thoracic rotation, then we have problems, all right? Because that changes the angle of our axis of motion and then makes for a lot of back pain, all right? And another one is easy. You probably are very familiar with this. It's called over the top. It's a faulty swing plane. It usually happens when we're starting the downswing with the upper body and not the lower body, okay? So we want to have that inside to out swing, not over the top, okay, where it's outside to in. All right, so that's pretty easy. All right, so physical screens. These are some tests that we do to determine how somebody moves and build this picture of how the body relates to the golf swing. And it's part of the 16-point full body golf movement screen that TPI has developed and that I do for all my golfers that comes in. All right, the pelvic rotation test. All right, we need to be able to dissociate the lower body and the upper body to engage the abdominals. So you can do this test right now. All you need to do is get up, get into golf posture, put your hands across your chest. Do not move your torso. Don't move your shoulders, and see if you can only rotate your pelvis. okay? We want to use that, your core to do this move, okay? The common fault that people do is they go lateral. They rock side to side, right? So it's a lateral pushing motion versus a rotary motion. And then the other fault is that the upper body moves. We need to be able to keep that upper body still. And that's due to poor core stabilization. This is a picture of Charlie Hoffman, a before and after photo or video of how he does the pelvic movement here. Very unstable to begin with, and then after some training, this is a professional golfer. He knows how to move his body. We were able to change that, and that was the year. I think this was the year that the last year that he won too, when he was doing that. All right. The next one is the seated trunk test. You can do this at home too. Sit at the edge of your chair. Get your feet and knees together. Put a club behind your shoulders. Try and rotate and see, can you pass 45 degrees? Professional golfers can go past 60. The key thing is that the knees need to be stable. If the knees move, you're cheating. The body's all about compensating through your deficits. So most of the time, people will move their knees to rotate. This is a picture of Billy Horschel as he's doing it. So, the pros here is super easy, how much he rotates and how much his knees don't even move. All right, both directions. All right. So the exercises that we're going to go through today, it's not an exhaustive list. This is an introduction only. Your individual results may vary based upon your body. And again, if you have any pain, do not do these exercises. There's a lot of compensations that can happen, and we can modify the exercises so that they are pain-free. We never want to feed into pain, especially if you do have pain with exercises. So no pain, no gain is total fallacy. Do not follow that. All right. So this is our hierarchy of movement. You need to build a solid base in order to play a sport with skill. All right. Exercises, we need to address mobility, stability, and strength. And there's like, a dozen more we need to cover, but this is going to be a good intro video for you. So if we want to be good at our sport, at the top of this thing, and skill, we need to have power and speed. We need to have strength and stability. We need to have tissue extensibility, flexibility, and range of motion and joint mobility. So all of these things below, if we don't have anything, we don't have a base, we can't move well in our sport. All right. So this is an open book stretch. We're going to move back and forth with this. Let me pull this up to full screen here. You're begin lying on your side. Lying on your side, your knees are going to be bent. It's important that the knees are higher than your hips. All right. That way, when you bring your knees up and you flex the hips a lot, right, when you bring your knees past your hips, that rounds out your lower back. You round out the lower back. We lock it out that way so that when you do the rotation, it's not rotating through your lower back. Like we talked about before, the lower back needs to be stable. The thoracic spine needs to be mobile. And this is a thoracic spine stretch. Okay, so going back and forth, about 1.5 minutes, 2 minutes. The next one is going to be hip drops. Hip drops here, we're going to try and rotate the lower half and not the upper half. So on your back, feet nice and wide. We want to try and keep your ribs still at the very least, or your lower, your lower back at least on the ground, not moving. And then we've got the hip flexor stretch. So the hip flexor stretch is, one of those things that are easy to, muck up, to do incorrectly. But we want to make sure we're going to talk a little bit about what that looks like when you do it correctly. All right. So the other thing that we want to go over today or tonight is our warm-up routine. I had another client ask me the other day, or actually yesterday. He asked me about, how does he warm up for his round? What's the best way? Because he usually rolls up, he's got like 5-6 minutes to get ready. All right, perfect. I got this 5 or 6 minute perfect warm up for you. All right, so let me pull up a different screen here. Let's do this and then go down like this, a little bit higher. All right, so I got my 2-shot here. We did review those 2 exercises, the open book test for rotation of your thoracic spine and that hip drop lying on your back for the lower body. Now, that hip flexor is very important. Let me show you on my left side here, facing this way. The hip flexor stretch is traditionally done in this kneeling position, okay? The key points is that as you go forward, we cannot let your lower back arch, okay? So if we have this opening of your pubic bone from your sternum, and that opens up like that, you're not doing a hip flexor stretch, you're doing a back stretch. So we want to lock that down. First step, we want to contract your glutes. Get these on as much as you can. Keep the abdominals on. That normalizes your pelvic alignment, your lower back. And then you bring your pelvis forward. As you keep those things on, that makes your stretch much more specific to the front part of your hip. Why is that important? Because if you are tight in the front part of your hip, your body cannot access that range of motion that you're supposed to have in your hip, and also inhibits the ability for your glutes to fire when you're doing a golf swing. All right, glutes are key for the golf swing. All right, so let's go over this quick warm-up routine. Okay, first thing, you don't need to lie down. You can do this at the range. Don't warm up at home, stretch out of home, and then drive to the course or the driving range. Okay, so you're gonna get out of your car, get your clubs out, or put like 2 clubs down, or you could use the golf cart or whatever, just to hold on to something. And you're gonna start with leg swing. Okay, you're gonna swing your leg forward and backward. And as we're doing this, I'll show you from the front here and from the sides. My hamstrings are really tight. I just worked out. So basically, you're going to go forward and backward. The key thing is that the upper body stays still. All right, here's the side view. Upper body stays still. Lower body, leg stays straight. I'm swinging this, activating the glute to get my leg behind me and stretching out the hamstrings to go up. My shoulders stay still, and I'm not bending this knee. I'm not doing this, okay? So I want to do this. So about 30 seconds each side, and then we go to across the body. So we add a little bit of rotation. So you're going to give yourself some space, and you're going to swing a leg left to right with the toe up on either end, okay? So as we're doing this, we're rotating through the legs, swinging this one, rotating this way, toe up on either side, and we're also rotating on the standing leg. And if you're holding onto your cart or 2 golf clubs, we're also going to get rotation through your thoracic spine from the bottom up, okay? So again, shoulders as still as possible as you rotate, toe up, legs straight, 30 seconds each side, all right? And then we're going to put that away and do an A-frame stretch, which is basically getting into a very deep hip hinge, almost like golf posture. Here's our golf posture. So I'm going to take it even lower, drop myself even down. The key thing with this is that I don't want to do rounded back, all right? This is not how we swing a club. We actually have to keep our back straight when we address the ball, right? So we don't want to get into posture like this, all right? So you want to really focus. This is another point. Get into a good hip hinge when you're trying to get to address, okay? The A-frame stretch is done with a straight back, pinning the elbow and the fist between the knees, and then taking the hand and rotating it up to the ceiling and turning your head. That's key because you want to see and rotate with the neck as you rotate the arm, okay? So I'll show you from the front. I get into my posture here, pinning the elbow and fist, hand goes here, and I rotate up. Rotate up. So I'm taking that shoulder and my head goes along with it. I do not want to do just arm, which is basically this, and I'm doing this, all right? That is all shoulder, and then you're liable to create some shoulder issues. We want to rotate through the thoracic spine and then have that arm lead the same way as our shoulder line, all right? So that's the A-frame stretch. And then the next one, we start to activate the lower body using lunges and a club, all right? So it's all about glutes. We talked about how we create power with the glutes and staying in posture. We want to try and lunge and rotate. So I'm just going to simply take my club, and I'm going to take a step back, and then get into a little lunge, and then rotate over the lead leg, okay? So I just do this. So I'm here, I'm rotating. I feel that this leg is loaded. I'm on my heel. My hip goes back. My knee does not go forward because we don't get into golf posture with the knee forward. Hold on. I don't want to get into golf posture like this with the knees go forward. It's basically a hip hinge. So I'm replicating that move, loading the glute as I'm swinging the club or rolling the club out to the side of that same leg, right? So here we are from the front again, doing the right leg, a little bit of a lunge, activating the glutes as well as rotating through the torso. Yeah, that's one way, 30 seconds each side. If you're more advanced and you have good balance, We can add the second leg. We can go here and then here. Rotate down, rotate up, rotate to the left, rotate to the right, driving through the hip as we're doing that. So that's another advanced way to do that, okay? And then another simple one is just gonna be rotating and adding a little bit of shoulder external rotation stretch. This is important for their trail side. All right, so I'm just holding my club head and I'm rotating this way. This is basically the shape of my arm that I want to get at the top of my backswing, right? So I want that 90-degree angle, keep that elbow tucked. And I'm just taking my club and I'm warming up that way. If you want to do the other side, that's fine too. We want to be able to rotate easily through the thoracic spine as we're stretching out that shoulder. All right? Now, the big money move is how to get rid of a reverse spine angle. If you have back pain, this is going to be for you. One of the things that it can do for you is you're going to pack an exercise band, a loop, some sort. You're going to, let me explain first that at the top of your backswing, if I rotate to the top of my backswing and my trunk is facing that way, down the line towards the target, that shuts off the quads. The core, right? I want to be able to rotate and then get behind the ball and have my torso face this way, okay? Pointing this way, not that way. And we want to engage the abdominals. So what I do with this is I put this underneath my lead side. So maybe I'll show you from the front here. I'm going to be face on. It's on my lead foot. I'm going to put my hands right on my chest, all right? And I'm going to rotate my torso. My head stays down. I'm looking at an imaginary ball. I got my target. I'm rotating to the top of my backswing. So here, the band is helping me to stay in posture. I'm not doing this, okay? Because we take the arms out of it. So often people get into this reverse spine angle because they need to get their hands higher to make a bigger swing. And that's what causes the tip towards the line or down the line. So we're going to do here, rotate, and then wherever my sternum is pointing, I'm going to put my hands out, okay? So I rotate top of my backswing, and then sternum pointing this way. That's where I put my hands. I'm just going to hold it. I do not want to take this and then swing it like that. That's just going to feed into the reverse spine angle. And when I do this rotation, I do not want to put this up, because if I push this up into where my arms would be from top of my backswing, that's going to feed into the reverse spine angle. So we want to make sure that I stay down, stay behind the ball almost, trunk leaning away from the target, and where my torso is pointing, that's where I'm going to stick my hands. Has nothing to do with my hand position with my swing. It's all about where is my torso and is my core on. So holding that for 10, 15, or 20 seconds helps to engage the abdominals and keep you in posture so that you can use your ground reaction forces, your feet, get to the ball in your downswing. All right. So let's kind of go back to my two-shot here. Let's pull this up. All right, any questions from anybody? Let me just take a moment and check the chat. All right, I think we're good. All right. So next, a word of pain. Pain is not a normal part of aging. All right, I'll just put it out there. So many times I have people come in and say, you know what, I'm 40 and I've got this pain and it's just about getting old. Or they're 60 and like, yeah, now my doctor said I got to live with this back pain, and they just relegate themselves. It's not. Pain is a signal that there's something wrong. And you know what? Pain can happen in the complete absence of any tissue damage. So many clients say that it's just a fact of life, but it's not, because you can be better. You can improve yourself. If we can address this hierarchy, get these things moving and have the movements that are physiologically normal, then there's no reason why you should be living with pain and be sore after your round, right? It's about, maintaining your body. If you have a vehicle, if you own a car, you maintain your car, you change the oil, rotate the tires, whatever, so it lasts a long time. What about your body? What are you doing to maintain this? And remember that we need to assess how you move, what your body is like, to develop a good golf fitness routine. So we need to address your individual and unique deficits. So a lot of times people will just go to YouTube and say, I saw this video, it worked for me. But you know what? No one YouTube video will be the complete answer. A physical exam and assessment, like I said in the beginning, is the key to fixing the root causes of your problems and power leaks so that you avoid injury. All right. So recap of what we learned tonight. All right. We learned that deceleration and stabilization is the key to acceleration and speed. All right. You can't have a Corvette or Ferrari without any brakes. Okay. You need to be able to tap into that power. But the only way to do that is you got to slow down. You got to be able to decelerate and control. All right. And we need to use the ground reaction force to create rotation, that push pull. Imagine kicking the dirt out forward with your lead leg. And then that starts the lower body rotation like a whip and then gets you moving faster. That's the big secret. And the dissociation of the trunk and the pelvis, being able to move one segment and not move the other, stabilize the other. That's key to a consistent golf swing. All right. And then we talked about the 3 mobility exercises and how to warm up the perfect golf warm-up routine that addresses all the factors, all the key factors for a golf swing. And oh yeah, now we've got, let me see, did I cover everything? Yes. And then now a special offer for everyone that's here. Thank you so much for hanging out with me. It's like 40